I want to share something I've been observing in my practice for the better part of 2 decades now. Something that doesn't get nearly enough attention in our quick 15-minute appointments. It's not dramatic, and I'm not here to promise you miracles or sell you on the latest health trend. What I am here to do is share a pattern I've seen repeatedly. A pattern that connects how we eat, how we rest, and how our bodies manage the constant demands we place on them to our long-term health and disease risk. I've been practicing medicine for over 20 years, and in that time, I've had the privilege of caring for thousands of patients. Many of them come to me worried about cancer, about chronic disease, about why, despite doing what they think is right, their health markers keep trending in the wrong direction. And over the years, I've noticed something that doesn't fit neatly into our conventional conversations about diet and exercise. It has to do with what I call metabolic stress. The constant pressure we place on our body's internal systems, often without realizing it. Now, let me be very clear from the start. I'm not going to tell you that what I'm about to explain will cure disease. I'm not going to suggest that changing one aspect of your lifestyle will reverse cancer or prevent it with absolute certainty. Medicine doesn't work that way. Biology is far more complex than that. What I can tell you is that research is increasingly pointing to a connection between our metabolic state, the internal environment our cells live in every single day, and our risk for developing serious diseases, including cancer. And I think it's worth understanding. This conversation is about patterns, not promises. It's about what happens inside your body when you give it certain signals, day after day, year after year. It's about understanding that your cells don't just respond to what you eat, but to how often you eat, how much rest your digestive and metabolic systems get, and whether your body is constantly in a state of activity, or whether it ever gets the chance to shift into repair and maintenance mode. I think one of the things most people overlook, and frankly, one of the things we don't emphasize enough in medical training, is the importance of the body's internal environment. We talk a lot about external factors, smoking, pollution, UV exposure, and those matter enormously, but we don't talk as much about the signals we send our cells every single day through our eating patterns, our stress levels, and our sleep. We tend to think of food simply as fuel or as nutrients, protein, carbohydrates, fats, vitamins, and that's true, but it's incomplete. Every time you eat, you're not just delivering nutrients, you're sending signals. You're telling your body that energy is coming in, that it needs to release insulin, that it should prioritize storage and growth rather than repair and cleanup. And in moderation, with appropriate semi-diet timing. This is perfectly normal and healthy. But here's what I see constantly in my clinic. People eating from the moment they wake up until the moment they go to bed. Breakfast at 7, snack at 10, lunch at noon. Another snack at 3, dinner at 6, and something sweet at 9. Every single day for decades. Now, culturally, we've been told this is fine, even healthy. Small, frequent meals to keep your metabolism going, to keep your blood sugar stable. And for some people, in some contexts, that advice made sense. But what we didn't fully appreciate, and what the research is now making clearer, is that this pattern of constant eating never gives your body the signal to shift gears. It keeps you in a state of constant metabolic activity. Your insulin levels rarely drop. Your cells rarely get the message that it's time to clean house, repair damage, recycle old proteins, or address cellular debris. Let me explain the biology here in simple terms, because I think understanding this helps everything else make sense. When you eat, especially when you eat carbohydrates and proteins, your blood sugar rises. That's normal. In response, your pancreas releases insulin. Insulin's job is to help shuttle that sugar into your cells for energy or into storage. But insulin does more than that. It's a growth signal. It tells your cells, this is a time for activity, for building, for growth. And again, this is healthy and necessary. But here's the part most people don't realize. When insulin is elevated, your body also suppresses certain cleanup and repair processes. There are cellular mechanisms. Autophagy is one of the terms you might have heard, that essentially allow your cells to break down damaged components, recycle old proteins, and clear out potential problems. Think of it like this. Your body has two primary modes. One is activity mode, where you're taking in energy, building, growing, staying active. The other is repair mode, where you're cleaning up, fixing damage, addressing wear and tear. Both are essential. But if you're constantly in activity mode because you're constantly eating, you never fully shift into repair mode. Now, you might be thinking, what does this have to do with cancer? That's a fair question, and it's one I've spent a lot of time considering. Cancer is an incredibly complex disease. It's not one thing. It arises from multiple factors: genetic mutations, environmental exposures, immune system function, chronic inflammation, and yes, metabolic signals. We know from decades of research that cancer cells behave differently from normal cells in many ways. But one consistent difference is how they use energy. Cancer cells tend to rely heavily on glucose, on sugar, for fuel. This is called the Warburg Effect, and it's been known since the 1920s. But beyond how cancer cells fuel themselves, there's growing evidence that the metabolic environment in which our cells exist, the levels of insulin, glucose, inflammation, and growth factors circulating in our blood, may influence cancer development and progression. High insulin levels, chronic inflammation, and constant growth signaling may create an environment that supports the survival and proliferation of abnormal cells. Conversely, periods of lower insulin, reduced inflammation, and activation of cellular repair mechanisms may help the body identify and eliminate damaged or precancerous cells before they become a problem. Let me be very precise with my language here. I'm not saying that eating frequently causes cancer. I'm not saying that changing your eating pattern will prevent cancer with certainty. What I am saying is that research suggests that chronic metabolic stress, persistently elevated insulin, chronic inflammation, and constant growth signaling may increase the risk of cancer development, and that giving your body regular periods of metabolic rest may support the natural processes that help protect against disease. In my practice, I've seen patients make changes to how and when they eat. Not extreme changes, not starvation, just creating longer windows between meals. And I've observed improvements in inflammatory markers, in blood sugar control, in energy levels, and in overall metabolic health. Do these changes guarantee that someone won't develop cancer? Absolutely not. But do they seem to improve the internal environment in ways that align with what the research suggests might be protective? In many cases, yes. I had a patient, a woman in her early 60s, who came to me concerned about her family history of breast cancer. Her mother had it, her aunt had it. She was doing everything she thought was right. She ate what she considered a healthy diet. She exercised regularly, she didn't smoke. But her labs showed prediabetes, elevated inflammatory markers, and she was carrying extra weight around her midsection despite her efforts. We talked about the role of insulin and metabolic stress. She made a simple change. She stopped snacking constantly and started eating within a more defined window each day, giving her body longer stretches without food. She didn't starve herself. She ate satisfying meals, but she gave her metabolism time to rest. Over the following months, her fasting insulin dropped significantly. Her inflammatory markers improved. She lost weight without consciously restricting calories. And more importantly, she felt better. More energy, better sleep, clearer thinking. Now, did this eliminate her cancer risk? I can't say that. But did it improve her metabolic health in ways that research suggests might be protective? I believe so. I want to pause here and be very clear about what this is and what it is not. This is not about starvation. This is not about extreme fasting for days on end. This is not about depriving your body of nutrition. And this is absolutely not a replacement for medical treatment if you have cancer or any other serious disease. What this is about is awareness. It's about understanding that the timing of when we eat, not just what we eat, sends powerful signals to our cells. It's about recognizing that our bodies evolved in an environment where food wasn't constantly available, where there were natural periods of eating and natural periods of fasting. and that those rhythms allowed for both activity and repair. In our modern world, we've disrupted those rhythms. Food is available 24 hours a day. We've been told that skipping meals is dangerous, that we need to eat constantly to maintain our metabolism. And as a result, many of us never give our metabolic systems a break. We never allow insulin levels to drop. We never activate those cellular cleanup processes. And over time, this chronic metabolic stress, this constant signaling for growth and storage, may contribute to the development of chronic diseases, including cancer. Now, I need to emphasize something crucial. This approach is not appropriate for everyone. If you have diabetes and you're taking insulin or certain other medications, you absolutely cannot make changes to your eating patterns without close medical supervision. If you have a history of eating disorders, this is not for you. If you're currently undergoing cancer treatment, you need to follow your oncologist's nutritional guidance, which often includes maintaining regular eating to support your body through treatment. If you're pregnant or breastfeeding, this is not the time for metabolic experiments. If you have severe heart disease, kidney disease, or other serious medical conditions, you need to consult with your physician before making any changes. I cannot stress this enough. I'm sharing information about metabolic health and what the research suggests. But I'm not prescribing a specific protocol for you personally. Every individual is different. Every medical situation is unique. And any significant change to your eating patterns should be discussed with a doctor who knows your full medical history. Let me address some common myths and fears I hear in my practice, because I think these prevent people from even considering the role of metabolic health in disease prevention. The first fear is that not eating frequently will slow your metabolism. I hear this constantly. People are terrified that if they skip a meal or go several hours without eating, their metabolism will crash and they'll gain weight. This fear comes from outdated ideas about metabolism that simply don't hold up to modern research. Your metabolism doesn't slow down from missing a meal or even from fasting for a day or two. In fact, research shows that metabolic rate can actually increase slightly during short-term fasting as your body ramps up certain hormones, like norepinephrine. What does slow metabolism over time is chronic calorie restriction. Eating very little day after day, week after week. That's different from periodically giving your digestive system a rest while eating adequately when you do eat. The second fear is muscle loss. People worry that if they're not constantly eating protein, they'll lose muscle. And yes, if you're literally starving yourself for extended periods, muscle loss will occur. But we're not talking about that. We're talking about allowing appropriate windows between meals. Your body is perfectly capable of maintaining muscle mass during periods of metabolic rest, especially if you're eating adequate protein when you do eat and staying physically active. In fact, some of the cellular processes that are activated during fasting actually help preserve muscle by promoting cellular cleanup and efficiency. The third fear is blood sugar crashes. People who are used to eating constantly often experience significant drops in energy and mood if they miss a meal. They interpret this as their blood sugar crashing, as proof that they need to eat frequently. But what's often happening is that their bodies have become dependent on constant glucose intake. They've lost metabolic flexibility, the ability to efficiently switch between burning glucose and burning fat for fuel. When you give your body time to adapt, when you gradually extend the time between meals, most people find that their energy actually stabilizes. They become better at accessing stored energy. Those dramatic swings in blood sugar and mood diminish. I think one of the reasons this conversation about metabolic stress and disease risk isn't happening more often in mainstream medicine is simply time. In a typical medical appointment, we have 15 minutes. In that time, we need to review your history, address your immediate concerns, order appropriate tests, and provide guidance. There's barely time to scratch the surface of preventive medicine, let alone have a nuanced conversation about metabolic health and cellular signaling. So we default to simple, time-efficient advice. Eat a balanced diet. Exercise regularly. Don't smoke. All important, but incomplete. There's also the challenge of evidence. Medicine rightly demands high-quality evidence before making recommendations. And while the research on metabolic health, fasting, and disease risk is growing rapidly and is quite compelling, we don't yet have 50-year randomized controlled trials proving that specific eating patterns prevent cancer. We likely never will, because those studies are nearly impossible to conduct. So we're left with mechanistic studies, animal research, observational data, and shorter-term human trials, all of which point in a consistent direction, but which don't provide the level of certainty we'd ideally want. I'm not part of any conspiracy. I don't think information is being suppressed. I think we're simply in a transitional period where the science is ahead of the clinical guidelines, where doctors like me are seeing the research and observing changes in our patients. But the formal medical establishment hasn't yet fully caught up, and that's okay. That's how medicine progresses. But it does mean that patients who are interested in optimizing their metabolic health often need to take some initiative, to educate themselves, to ask questions, and to work with doctors who are paying attention to this emerging field. So what does this look like in practice? I want to be careful here because I'm not prescribing a specific protocol, but I can share what I discuss with patients who are interested in improving their metabolic health. The first consideration is simply becoming aware of how often you're eating. Many people, when they actually track it, are surprised to realize they're putting food in their mouths every 2 to 3 hours, from morning until night. That's a lot of metabolic activity without much rest. The second consideration is thinking about whether you can create slightly longer windows between meals. This doesn't mean skipping meals if that doesn't work for you. It might just mean eliminating the constant snacking. Eating 3 meals a day with nothing in between, for instance, already gives your body meaningful periods of metabolic rest. For some people, condensing eating into a slightly shorter window during the day, say 10 or 12 hours instead of 16, feels natural and sustainable. The key is that it should feel sustainable, not punishing. The third consideration is what you eat when you do eat. If you're going to have longer periods between meals, those meals need to be satisfying and nutritious. Adequate protein, healthy fats, fiber-rich vegetables, whole foods that keep you satiated and provide the nutrients your body needs. This isn't about deprivation. It's about alignment with your body's natural rhythms. And the fourth consideration is listening to your body and working with a healthcare provider. If you try adjusting your eating window and you feel terrible, if your energy crashes, if you can't concentrate, if you feel anxious or shaky, that's important information. It might mean you're trying to change too much too fast. It might mean you have an underlying metabolic issue that needs to be addressed first. It might mean this particular approach isn't right for your body at this time, and that's okay. There's no one-size-fits-all approach to health. I've had patients who found that simply stopping late-night snacking made a noticeable difference in how they felt. Others who found that skipping breakfast felt natural once they adapted and gave them better energy throughout the morning. Others who preferred eating an earlier dinner and having a longer overnight fast. The specifics matter less than the principle, giving your metabolism regular periods of rest. What I want you to understand is that your body is remarkably resilient and adaptive. It has sophisticated systems for repair, for cleanup, for identifying and eliminating damaged cells. But those systems need the right signals to activate. They need periods of low insulin. They need activation of cellular stress response pathways that trigger maintenance and repair. They need an internal environment that supports health rather than constant growth. I know this conversation can feel overwhelming, especially if you're already worried about your health, or if you have a family history of cancer, and I want to address that fear directly. Fear is understandable, but it's not useful if it paralyzes you. What's useful is understanding that you have more influence over your internal environment than you might have thought. You can't control your genetics, though even gene expression can be influenced by lifestyle. You can't control every environmental exposure, but you can influence the daily signals you send to your cells through how and when you eat, how you manage stress, how you sleep, how you move. And even small changes, modest adjustments that feel sustainable, can shift your metabolic health in meaningful ways. I've seen it over and over again in my practice. Patients who make gradual, thoughtful changes and who give those changes time to work often see improvements not just in lab values, but in how they feel. Better energy, better sleep, less inflammation, better blood sugar control. And while I can't promise that these changes will prevent cancer or any other specific disease, I can tell you that they create an internal environment that aligns with what the research suggests is protective. It's also important to remember that health is multifactorial. Metabolic health is one piece of a larger puzzle. Sleep matters enormously. Chronic stress is inflammatory and impacts every system in your body. Movement and physical activity are essential not just for cardiovascular health, but for metabolic health and cancer risk reduction. Social connection, purpose, mental health, all of these influence your biology in ways we're only beginning to fully understand. So while I'm focusing on metabolic stress in this conversation, please don't interpret that as me saying it's the only thing that matters. It's one important piece. I also want to acknowledge that making changes can be challenging, especially in a world designed around constant eating. Social events revolve around food. Work cultures often involve constant snacking. Family traditions are built around meals at specific times. And that's okay. Life is meant to be lived. Flexibility and enjoyment matter. The goal isn't perfection. The goal is awareness and making choices that generally support your health while still allowing for the flexibility to be human. If you take nothing else from this conversation, I hope you take this. Your body is not just a collection of parts that break down randomly over time. It's a dynamic system that responds to the signals you give it. The food you eat, the timing of when you eat, the stress you carry, the sleep you get. All of these send messages to your cells about what kind of internal environment to create. And that internal environment, sustained over months and years and decades, influences your risk for chronic disease, including cancer. We know from research that certain metabolic states are associated with higher disease risk. Chronic high insulin levels, persistent inflammation, constant activation of growth pathways. These are associated with increased cancer risk in multiple studies. Conversely, metabolic states characterized by periods of lower insulin, reduced inflammation, and activation of cellular maintenance pathways appear to be protective in both animal models and observational human studies. Can I promise you that adjusting your eating patterns will prevent cancer? No. Medicine doesn't deal in guarantees, and anyone who promises you a cure or certain prevention is not being honest. But can I tell you that creating a healthier metabolic environment is likely to reduce your risk and support your overall health in meaningful ways? Yes. The evidence strongly suggests that. Let me also say this. If you currently have cancer, or if you're at high risk, please do not interpret anything I've said as a suggestion to replace conventional medical treatment, surgery, chemotherapy, radiation, immunotherapy. These treatments save lives. They're essential. What I'm talking about is the foundation of metabolic health that supports your body's natural defenses, potentially reduces risk, and may complement medical treatment when treatment is necessary. But it's not a replacement. And if you're working with an oncologist or another specialist, please discuss any significant dietary or lifestyle changes with them. Some patients undergoing cancer treatment need to maintain regular eating to support their body through the rigors of treatment. Others might benefit from metabolic approaches, but that needs to be individualized and supervised. Your medical team needs to know what you're doing so they can guide you appropriately. I think what gives me hope in all of this is that the human body, when given the right conditions, is extraordinarily good at healing and maintaining itself. We have repair mechanisms. We have immune surveillance that identifies and eliminates abnormal cells. We have antioxidant systems and detoxification pathways and cellular cleanup processes. All of these exist to protect us, but they need the right internal environment to function optimally. And in our modern world, with constant food availability and chronic stress and disrupted sleep, we've created an internal environment that often works against these protective mechanisms. The good news is that we can change that, not overnight, not with perfection, but gradually and sustainably, by becoming more aware of our eating patterns, by giving our metabolism time to rest and shift into repair mode, By managing stress, by prioritizing sleep, by staying physically active, by maintaining social connections. All of these influence our metabolic health and our internal environment. So, to bring all of this together, what I want you to understand is that metabolic stress, the chronic state of elevated insulin, inflammation, and constant growth, signaling that results from eating constantly throughout the day, appears to create an internal environment that may increase cancer risk and the risk of other chronic diseases. This isn't about blame. Most people eating this way were following advice they thought was healthy. But the research is now pointing us in a different direction, toward the importance of metabolic rest, of giving our bodies time to activate repair and cleanup processes. This doesn't require extreme measures. It doesn't require starvation or deprivation. It requires awareness and modest, sustainable adjustments to eating patterns. It requires understanding that when you eat matters as much as what you eat. And it requires patience, because metabolic health improves gradually, not overnight. The signals you send your cells today influence your health tomorrow and years from now, creating longer windows between meals, allowing insulin to drop, activating cellular maintenance pathways. These are signals that appear to support health and potentially reduce disease risk based on the emerging research, combined with other healthy lifestyle practices. Adequate sleep, stress management, physical activity. These metabolic adjustments may meaningfully improve your long-term health trajectory. If you found this information helpful, I'd appreciate if you'd consider subscribing to the channel. I'll be making more videos exploring topics like this. Practical, evidence-based conversations about health that go beyond the surface-level advice you usually hear. Next time, I want to talk about inflammation, what it really is, why chronic inflammation is so concerning, and what you can actually do about it from a metabolic and lifestyle perspective. Thank you for taking the time to listen today. I know this is complex information, and I appreciate your willingness to engage with it thoughtfully. Remember, small steps, sustained over time, can lead to meaningful change. You have more influence over your health than you might think. Take care, and I'll see you in the next video.